Hi, I'm Dr. Farley, and today I want to talk about hygiene. Specifically, how do you clean around your All-on-4 or All-on-X hybrid, whatever you want to call it. I've seen way too many people in my career who had the work done somewhere and were unable to clean, and because of it, they are now having problems. Sometimes bad problems, like we're removing all their implants. So I learned at an early point in my career that while this procedure is fantastic, you have to maintain it or you're gonna lose it. And this is such an investment and it's such a change for you. I don't want you to lose it. And so I wanna go over what that aftercare looks like, both what you're gonna do at home and what you're gonna do when you come in to see us for regular checkups. Let's start with the home stuff. When we have people work with us, we feel so strongly about the hygiene that we're gonna give you a Waterpik and we're gonna give you a bunch of brushes. Reason being is we really want you to keep these implants as long as possible. There's different Waterpiks on the market. They all do the same thing. That's shooting a stream of water at a high force so that you can knock stuff out. The one that we have been giving people for many years is this portable handheld one. The idea is you put water in it, you turn it on, and through this little spot right here, you aim a stream of water into that gap. You're using it to knock food or debris out of that little gap. Now, a Waterpik is awesome for knocking big chunks, but it's not going to do anything about knocking off what's called the biofilm. Biofilm is what you get when bacteria are grabbing onto the side of your prosthesis, and then more come, and then more come, and then more come. And usually it's like what people call plaque on our teeth. It's like a thin, gunky looking film that covers everything. A Waterpik won't get all of that off. Don't think that it will, because it never is going to effectively clean. You always have to follow up the Waterpik. Twice a day, you first hit it with the Waterpik, then the brushes. Twice a week, there's some of the brushes that come in this kit that require a little bit more patience, a little bit more time. So I say twice a week do those. So this is the kit. It's a company called TP, and you can buy these on their website, but we'll give you a kit to start, and in the kit is a variety of things, some of which are on this little stand here. We'll go over it with you when it's time for you to start learning these things. This brush here has these really fine, very soft bristles. It's a surgical brush. You just use that for a couple weeks after surgery. These are the ones that you're gonna be using for your maintenance, and it's these two that you're gonna use daily, twice a day. Remember, Waterpik knocks the big chunks out, but you gotta get in there with something else. It's a much thinner brush. There's just 2 rows of bristles, and because it's thin, it can reach into that little gap out here on the front. The goal with this is to go in your mouth and to brush right along here all the way to the back. This doesn't do a good job getting around the back, and it doesn't do a good job getting up in here. That's where the second brush comes in. So while this one's good from one side to the other, this is good for getting behind, but then also, and I'll hold it this way you can see, so you're coming in from your mouth and you're reaching in and you are brushing that same gap but on the inside. These 2 brushes are very effective for cleaning the bulk of what's gonna get into that space. Even though you're gonna do that twice a day, you need to do more. Because this other one is a little bit more tedious, my recommendation, at least try to do it twice a week, where you're gonna set aside maybe 30 minutes to just do a nice thorough clean of everything. These are called interproximal brushes. If you look at this, one's very skinny and one of them is much wider, and there's sizes all in between. The goal is to take one of these and run it into that space. What this is gonna do that these other brushes did not is it's gonna clean all of the underside where it's actually touching the gums. Whereas this got into the grooves, this is one of the tools you have to try and get in and knock some of the debris, food, plaque off of that. So these interproximal brushes, they come in different sizes, and you wanna find the one that provides enough resistance to knock the biofilm off. So you'll start with the smallest one, and if you put that in and you're like, boy, this is going in nice and easy, chances are you should move up to the next size, because you should feel that resistance because it's the resistance that is knocking things off. A little bit more work, a little bit more challenging, especially an upper one. You're likely going to be using the smallest one. Sometimes even the smallest one is difficult for you to get in there. The other one that you could do, and it's something that comes in this kit, is to floss. This is something that when I was in school, it was a product called Super Floss, but they call this bridge and implant floss. The thing that's unique about this floss is there's different segments to it. Normal floss is just, you know, one diameter the whole way around. This one, as you can see, it has a stiff side, and then in the middle, it's soft, but it's thick. And the idea with this stiff side right here is you're gonna wanna try to feed this underneath that space. So you'll hold it just like this, and you'll try to push it into the space. Like if you've got an implant right here and right here, it's in between the implants. You're actually gonna take that and you're gonna try to push it into that space and feed it through until it comes out the other side. And then pull it through. And once you've done so, and you've got kind of a hold on it like this, where it's looping up and around your teeth, to then move it side to side. And by doing so, you're really knocking off that plaque. From the time we let you go with your final teeth, we're gonna try to get you back in 4 months. We wanna give you 4 months to do your best, and then we want to evaluate and see how you're doing. That way we can, you know, re-educate. We can say, oh, do this better, you're missing this spot, that kind of stuff. If we find that you're doing a good job, we don't need to see you every 4 months, but we do settle into an every 6 month kind of a thing. Same as if you had teeth. Because these teeth are screwed in, you can't take them out, but we can. So the big question is should we? Should we be removing these every time you come in for your hygiene? Some people do believe that that is what's necessary. Me personally, I do not. I feel like because we design them right and that you should be able to clean them yourself, you can. If we're always taking it out, putting it back in, you're gonna start wearing some things down. Screws are gonna be worn down. Sometimes we do need to do it. Sometimes we might look in your mouth after the cleaning's done, the hygienist had some concerns, we look in, we see some concerns, and we say, you know what, we should get you back in, take it off, get everything looked at a much deeper level, and then we'll go from there, but it's very rare. Thank you so much for watching. I hope you learned something. Watch some more of our videos. We have lots of things, lots of information. See you next time.